The Galindo family has yet to file suit, and part of the problem is deciding who's to blame.
Some of the things that show the relationships between the county, GEO Group, PNA.
But Torres says someone should have to answer for the death of a young man in custody.
It looks like there's plenty of blame to spread to different people, but I mean, there's some things that show problems in some of the facts that we're seeing show problems in just the one-on-one supervision, obviously, to kind of more systematic problems like just the general status of health care there. I mean, in the case of Jesus Galindo, where it's just so grossly irresponsible what they did to this man and his family by allowing him to die, and by allowing him to die in the manner that he did, where I'm sure this man was just gasping for breath like a fish out of water in his last moments.
Galindo had been moved to solitary confinement just weeks before he died. Why? Only Geo and the medical subcontractor know, and they are stonewalling. Here's one thing we do know. According to blood tests from an autopsy report, Galindo had, quote, below therapeutic levels, unquote, of anti-seizure medication. And Attorney Torres says this medical document he got from the facility proves how indifferent the care was. Here a doctor complained about Galindo's, quote, attitude problem after an examination. In the letter written the day before his death, Galindo concluded by saying, quote, I think of you, mother and father, as well as my children. I ask God and pray that he gets me out of here. By the time Galindo's body was finally discovered in the cell, rigor mortis had set in.
We have a responsibility to make sure they're treated decently. Nobody's talking about, Cadillac health care services or anything like that. I mean, we're just talking about basic needs. Do they have shelter? Is it adequate shelter? Are they being fed adequately? Okay. Are they receiving adequate medical care?
We wanted to know the answers to these questions as well. When we asked the Bureau of Prisons for an interview or a comment, they refused and told us to contact Reeves County and the GEO Group. They wouldn't comment either. We also reached out to the medical provider, Texas-based Physicians Network Association. They never returned our messages. But we did learn some things about Reeves from audio recordings of the county commissioners' meetings, led by County Judge Sam Contreras. For instance, we learned that the buildings lacked a sprinkler system in case of fire, and that the facility was significantly understaffed, according to a Bureau of Prisons letter the county judge read to commissioners.
Second page, it said, definitely the institute has been operating below 60% of the proposed staffing since. It's our opinion that your lack of staff, especially in the correction service, has led to performance problems. So that's a big one right there.
At another meeting, there was discussion that the riots were in fact caused by a lack of medical care, and that ill inmates were isolated or put in the SHU.
That's what started the disturbance, because they were being placed in the SHU when they do nothing wrong. They're just sick.
The inmates were not being provided immediate services. They had to wait for long days sometimes, just to be brought into the nursing office and then given a checkup or see what their need was.
One person who has seen Reeves facilities from the inside is Father Miguel Sanchez.
Yes, may I speak to Father Ben Flores, please?
He's a Catholic priest whose parish duties in Pecos included regularly visiting the detention center.
Yes, please.
He ministered to the workers as well as the inmates.
Some of the employees are also parishioners of the Catholic Church, and so yes, some of them will agree with what the inmates were saying in terms, for example, of the medical needs. That yes, they had to wait a long time, sometimes days, to be taken care of. So they were concerned because then, as employees, the inmates will get upset, will get angry, and they were the ones that had to deal with them, and they were angry because of the needs that they were requesting were not being met.
Some of the employees were also concerned about the staffing situation at the facility.
One of the complaints they had is that they were overworked, because they don't have enough employees. They're always advertising for more and more employment. They were exhausted because they had to work sometimes longer periods or even double shifts.
So what's the private prison company's take from this? GEO receives, after expenses, a monthly management fee of over $400,000. That's a yearly profit of $5 million, all paid by U.S. taxpayers. And that's just this facility. There are nearly a dozen others like this one across the country. And these are just Bureau of Prisons facilities. The U.S. Marshals and the Immigration, Customs, and Enforcement agencies also hire private prisons to house their detainees.
We know that abuses are occurring in private prisons. We know that people are dying unnecessarily in private prison. But we don't have the full story about what's going on because you can't get meaningful access to these private prisons.
Well, what happened to the idea that the best disinfectant for corruption and abuse is sunlight?
Government operates best when it doesn't operate in complete secrecy. Unfortunately, that's not a principle that the law currently extends to private prisons.
What's your greatest fears going on in there?
My greatest fear is that there are far more examples than even the ones that we've been able to uncover that are never going to be uncovered if there continues to be a lack of transparency about what's going on behind the walls of private prisons.